You've stretched, you've taken meds, you've done the physical therapy. Maybe you even had a procedure and/or surgery. And for a little while it worked, but then the pain came back. And now you're starting to wonder, is this just my life? Here's the truth nobody's telling you. Your back pain isn't coming back because your treatments have failed. In the next few minutes, I'm going to show you what's really going on and what to do about it starting today. You've done everything right. You followed the advice, showed up for the appointments, took the medications, and yet the relief never lasts. That cycle of hope and disappointment isn't just exhausting. It makes you stop trusting your own body. And worse yet, it makes you stop believing a solution even exists. I'm Dr. Sabir Rao, triple board certified in pain medicine, anesthesiology, and functional medicine. I've treated over 20,000 patients, and recurring back pain is the single most common pattern I see walk through my doors. I'm going to walk you through 5 real reasons your back pain keeps coming back. Reasons that go way beyond what shows up on the MRI, and I'll show you exactly what to do differently starting tonight. Point number 1. Your diagnosis might be right, but it's incomplete. Most back pain patients have been told they have a herniated disc, stenosis, or degenerative disc disease. And that might be accurate, but here's the problem. That diagnosis only describes the structural findings. It doesn't explain why that structure broke down in the first place, and it doesn't tell you why the pain keeps returning after treatment. A herniated disc is a what. It is never the full why. Here's what I tell my patients that surprises them every time. Your MRI is a photograph, not the whole movie, and you've been making treatment decisions based on a single frame. I see this weekly. A patient comes in with an MRI from 2 years ago showing a disc bulge at L4-5. They had an injection. Pain went away for a while. It came back. They had another injection, and the same cycle goes off. But when I actually evaluate what's driving the inflammation, why that specific disc is under pressure, what's happening with their posture, their core stability, their systemic inflammation, we almost always find 2 or 3 contributing factors that nobody ever even looked at. Think about it like a roof leak. You can patch the ceiling where the water stain is showing up and the stain disappears. But if the shingles on the roof are still cracked, the next storm brings the leak right back. The MRI shows you the water stain. My job is to find the cracked shingles. Next time you look at your imaging results, ask one question. This tells me what's damaged, but what caused the damage? If nobody has answered that second question, you've only gotten half the diagnosis. And here's why that matters more than you think. Because the most common cracked shingle behind recurring back pain is something most spine specialists never even test for. Point number 2. Inflammation is the invisible engine behind your own pain cycle. It's the root of all evil. When most people think about back pain, they think mechanical. Something's out of place, pinched, or worn down. But what I've learned after 20 years is that chronic low-grade inflammation is the silent accelerant behind almost every case of recurring back pain. The disc doesn't just degenerate on its own. Inflammation speeds the process. The nerve doesn't just stay irritated on its own. Inflammation keeps it firing. You can get the perfect injection, the perfect procedure, but if your body is running on a pro-inflammatory engine underneath, you are fighting the treatment with your own biology. In my functional medicine practice, I run advanced inflammatory panels on my back pain patients. What we find is striking. Elevated HSCRP, insulin resistance, hormone imbalances, nutrient deficiencies that directly affect tissue repair. And these aren't exotic findings. They are common. They're just rarely looked for in a standard pain management visit. Imagine trying to put out a campfire by blowing on the flames while somebody behind you is quietly pouring lighter fluid all over the logs. That's what treating back pain feels like when inflammation goes unchecked. Every treatment you try is fighting against an invisible force that nobody acknowledged. Here's a simple way to gauge this for yourself. Do you also deal with fatigue, brain fog, weight gain that won't budge, or joint stiffness in places other than your back? If you have back pain plus 2 or more of these symptoms, inflammation is almost certainly a cofactor, and no injection alone is going to solve that. Now, inflammation is a big piece. But there's another factor that makes back pain recur that I'll bet money nobody has ever mentioned to you, and it might be the most overlooked cause in all of spine care. If you're watching this and thinking, why has no one ever explained this to me in this way? You're not alone. That's exactly why I started this channel. Subscribe, and I'll keep breaking this down in ways that actually help you move forward. Now, let me show you the factor that almost everyone misses. Point number 3. Your spine doesn't exist in isolation, and neither does your pain. Our focus is on diagnostic clarity. Stop thinking of your pain or your back as the problem. Start thinking of it as the place where the problem shows up. Your spine is the central weight-bearing structure of your entire body. It is affected by everything: how your hips move, how strong your core is, how you sleep, what you eat, what your stress hormones are doing. When I evaluate recurring back pain, I'm not just looking at the spine, I'm looking at the full chain of systems that feed into it. And that's where the breakthrough happens. A huge number of my patients with lower back pain actually have a primary problem somewhere else. Weak glute muscles, shifting load onto the spine, hip dysfunction, changing their gait, hormonal decline accelerating disc degeneration, poor sleep preventing recovery overnight. The back is the victim, not the villain. But because we keep treating only the back, the real cause stays hidden. Ask yourself these 3 questions. Does your pain get worse after sitting for long periods of time, but nobody has assessed your hip mobility or core strength? Do you wake up stiff every morning, but nobody's evaluated your sleep quality or recovery capacity? Have you noticed your pain worsening as you've gotten older, gained weight, or lost energy, but nobody has connected those dots to your back? If you said yes to 2 or more, your back pain is not a back-only problem. It is a whole body problem wearing a back pain mask. So now you know the pain is often structural, inflammatory, and systemic. But knowing that and doing something about it are 2 very different things. And this next point is about the single biggest mistake I see patients make once they do understand all this. Point number 4, chasing one treatment at a time is why you stay stuck. The most expensive thing in medicine isn't any one procedure. It's wasted time bouncing between treatments that were never going to work alone. Here's the pattern I see constantly. A patient tries PT for 3 months, doesn't fully work. So they stop and try injections, get partial relief. So they stop and try medications, another temporary fix. Then someone says maybe surgery. And at each step, they're abandoning one approach and chasing the next, never combining, never integrating. That sequential one-at-a-time approach is the single biggest reason chronic back pain becomes a revolving door. When I build a treatment plan for a recurring back pain patient, I'm layering. We might calm the acute nerve irritation with a targeted injection while addressing inflammation through advanced lab work and dietary changes, while simultaneously rebuilding core stability, hip function with guided movements. These aren't 3 separate projects. They're 3 parts of one plan, and the combination of that creates results that last. Here's what to stop doing. Stop evaluating each treatment as pass or fail in isolation. An injection that gives you 50% is not a failure. It's one layer of a multi-layer solution. Here's what to start doing. Ask your provider this: what else should we be addressing at the same time to make this treatment work even better? If they don't have an answer, well, that's information worth having. Now I've shown you the real reasons back pain recurs and why isolated treatments don't hold. But none of that matters if you don't take action. So here's the one thing I want you to do tonight that can start shifting everything. Point number 5, the 2-question reset you can do tonight. You don't need another appointment to start making progress. You need 5 minutes and 2 honest questions. Every patient I've ever helped started the same way, by stopping long enough to ask why, instead of just asking what. Most people spend years asking, what can I do about my back pain? The patients who actually break the cycle are the ones who start asking, why does my back pain keep returning? The shift from what to why is the most powerful clinical tool I've seen in 20 years of practice. I had a patient who spent 4 years cycling through treatments, injections, therapy, medications, and even surgery. When he finally got to me, the first thing I did was sit him down and map his entire history, every treatment, every result, every gap. In 20 minutes, we found 3 root cause factors that nobody had ever even investigated together. Within 6 months, his pain was cut in half, not because of one magic treatment, because we finally treated actual problems instead of just symptoms. Tonight, sit down for 5 minutes and answer 2 questions in writing. Question number 1. Every time my back pain returns, what else is happening in my life or my body at the same time? Write down everything: stress, poor sleep, weight changes, less movements, more sitting, dietary changes. Look for the pattern. Your pain has a context, and that context is a clue. Question number 2. What has never been tested, checked, or evaluated? Think about it honestly. Has anyone ever really checked your inflammatory markers, your hormone levels, your hip mobility, your core function, your sleep quality? Write down every gap you can identify. Those two answers, the recurring context and the untested gaps, are the starting point for where a real root cause conversation with your next doctor can start. Bring them to your appointment, say, I've noticed a pattern, and here are the things nobody has looked at yet. That changes the entire dynamic of the visit. This exercise works because it forces pattern recognition. Chronic pain patients almost never connect their flare-ups to their broader health context. When you do, you stop seeing your back pain as random and start seeing it as predictable, and predictable problems are solvable. Final take-home message. Your back pain keeps coming back for a reason. Not because you're broken, not because you haven't tried hard enough, but because the full picture has never been assembled. The structural issue, the inflammatory load, the systemic contributors, and the treatment gaps all need to be on the same page, in the same plan, at the same time. That's when things change. If this shifted how you think about why your pain keeps coming back, go back and watch the video I did on what 20 years and 20,000 patients taught me about chronic pain. It lays the full foundation for understanding why root cause medicine matters, and it connects directly to everything we covered today. Click right here or check the link in the description, and I'll see you there.